Welcome. My name is Bob Martin, and I work for Startbupe.com. I hope that you're going to enjoy this video. We're going to try to help you today about relapse prevention. Jim Leonard and I are going to talk about post-acute withdrawal syndrome. There are two stages of withdrawal. The first stage is the acute stage. It usually lasts at most a few weeks, and during this stage you may experience physical withdrawal symptoms. Hopefully Dr. Red and the medication that he has you on will help you with withdrawal symptoms, but every person is different. The second stage that Jim and I are going to talk about today of withdrawal is called post-acute withdrawal syndrome. During this stage, you'll have fewer physical symptoms. Your medication should take care of those. But you may find that you experience emotional and psychological withdrawal symptoms. Post-acute withdrawal occurs because your brain chemistry is gradually returning to normal. As your brain improves, the level of your brain chemicals fluctuate as they approach the new equilibrium, causing post-acute withdrawal symptoms. Most people experience some post-acute withdrawal, whereas in the acute stage of withdrawal, every person is different. In post-acute withdrawal, most people have the same symptoms. What we're going to talk about is how this change affects you. Jim, could you tell us what an opiate patient is going to experience in post-acute withdrawal?
Particularly in the post-acute withdrawal, most opiate addicted people are going to experience a tremendous amount of emotional upheaval. That is key in dealing with this form of drug abuse, particularly in the opiate arena, because the emotional state at this time, based on what you just shared with as regarding what has happened to the brain with the individual now being a quote addicted to opioids, the brain in and of itself, during the process, as you mentioned, trying to readjust or adjust, okay, to some degree of whatever normalcy is for that individual, is going to be extremely difficult.
So mood swings, anxiety, and this general feeling of irritability is normal, you're saying?
Right, and that brings up an interesting thing. Particularly for the opioid, I'm going to keep the focus on that, because I believe, from my experience, all of what you just described was taking place before the individual started getting hooked up in opioids, because most people who end up being addicted have been trying to some way correct their irritability, discomfort, anxiety, panic attacks, whatever it is. And there is evidence now, very strong evidence now in the medical arena, that these things began in the very early stages of the individual's life, somewhere between the first 5 years.
What can you tell one of our patients to do that will help them get through these periods of irritability and anxiety?
Now that's very difficult in the sense of this. First of all, you and I and those of us dealing with it need to be able to get, I won't say the word trust, but I'll use the word that people rely on, that we are genuinely trying to help them. And in post-acute withdrawal, the symptoms of the mental and emotional condition of the individual was that person has a great deal of difficulty of depending on us rather than depending on the instant relief that they get from the opioid.
So it's very important that if you're experiencing these symptoms, that you reach out to a member of our staff or Dr. Rad to talk about that, or if you're going to 12-step self-help groups, to talk about these symptoms and these feelings with other sober people?
Yes, and that's all part of the whole spectrum of what we call this stuff of recovery. The excellent idea you pointed out is going to Dr. Rad or a physician that has an understanding. If you live in this community, in my experience, I've known Dr. Rad for 30 years, and I know his capability, and I know what he's capable of doing as far as providing the best possible treatment outcome and plans. So what's going to be required, and forgive me if I could use any other illness, when you go to see your physician, particular if it's anywhere on the heart, cancer, or pulmonary thing, you just don't go there and get some medication and told to do some exercise. There's a long process going on. And in Dr. Rad's practice, he is probably the best to start there to get a good medical workup, and then with collaboration with his staff and the individual to develop a plan, so to speak, or if you will, an ideal treatment modality that will not only address the addiction per se, the opioids, but what you're talking about here is the post-acute withdrawal, because everybody has it. Everybody has it in some form or not. Okay?
So that makes it, to me, more comforting. It's uncomfortable to go through mood swings. It's uncomfortable to go through post-acute withdrawal. But if I know I'm not unique and I know I'm not alone, there's people that I can safely share with.
Yeah, and that's an excellent point. And I think we should communicate to the people we deal with is that, from my point of view, we deal with this on three very important points. They need to understand the disease as it applies in medical terms. Okay. You also need to understand what an illness is. And I'll use that example a little bit later on. And the third thing is they have to have an understanding of what remission is. The disease, medical staff here will give a thorough medical assessment, if you will, that is complete in its whole approach. Not just what substance you're using, but a good psychological workup on the individual. We treat here with Dr. Rad the whole person. We don't treat the symptom. Okay, and in most concepts, good example is cancer. I understand, Bob, that you're a cancer survivor.
I am.
Okay. Let's just tell the folks, if you don't mind, tell the folks is, what was your experience before, during, and after the three phases of your recovery process of your own personal illness of cancer?
Sadly, we don't look at addiction as a disease. We say that it is, but even as a patient, we think that we've done something wrong. We think that there's something morally wrong with us, that we're bad people. No one wants to get cancer. No one deserves to get cancer. In 2010, I had a lot of symptoms that medical professionals were having difficulty finding what was causing them, and I had kidney cancer. I was treated surgically, and I was told that everything is okay, but I was also told that there's a period of time that I may not be in remission. So there is a relapse from cancer, is how I took it. And that during the next 5 years, there were times that I was irritable, anxious, had mood swings. Even though I had no more cancer in my body, I still had those emotional factors from the disease, and I had to get well from those. I had to come to grips with those. I had to talk to people that I trusted in the faith community, people in the recovery community, good friends, and medical professionals to help me through that. What we're offering here at Startbupe.com is we're offering treatment for the whole person for their opiate addiction. We thank you for joining us today. We hope that you will continue to watch these videos. I hope that you'll give us some feedback if they're helpful. And if you know a friend or loved one that is suffering from an opiate addiction, please contact us either at the phone number at the bottom of the screen or our webpage. Thank you and be blessed.